All right, welcome everybody. We're going to get started with our webinar for today. This is breast cancer prevention. My name is Dr. Kim Harris, and I am a naturopathic medical doctor here in Prescott, Arizona. I'm the owner of Prescott Medical Aesthetics and Wellness, and we do medical aesthetics, lasers, injectables. We do IV therapy, but we also focus on hormone replacement therapy, and we work with patients on prevention of different kinds and types of diseases. So I wanted to have this presentation today because October is Breast Cancer Awareness Month, and there is actually a lot that we can do to help reduce the risk of breast cancer. And so I felt really passionate about giving this talk today and making sure that people understand that there are things that you can do on a daily basis to reduce your risk of breast cancer. There's me. Like I said, I'm a naturopathic doctor. I've been in practice for about 8 years now in the state of Arizona, and we do offer a wide variety of services and products. And, as far as wellness, hormone replacement, all that kind of stuff. So I'm just going to get started talking a little bit about breast cancer. I mean, obviously, it's a well-known and well-studied topic. There are studies that are coming out all the time about breast cancer types, causes, treatments, because it is the second most common cancer in women after skin cancer. And about 240,000 women will be diagnosed with breast cancer per year in the United States, and 40,000 will die from it. Treatments are getting better, but obviously, best case scenario is that we're preventing it before it even happens. So let's see. I'm going to see if I can move my screen over here. There we go. Prevention, it's estimated that 70 to 90% of breast cancers are lifestyle related. We'll talk a little bit about what that means, but that's cancer in general. So many cancers are caused by the food that we eat, lack of exercise, supplements, nutrient status, that kind of stuff. So it is really important to look at lifestyle when we're talking about any kind of cancer prevention, but especially breast cancer. I mean, those numbers are, honestly scary to me. And, a lot of times we look at like family history of breast cancer, but most of the time it's not genetically linked, it's linked to lifestyle. So let's talk about those things that we can do to help not only make us feel better, but also, hopefully prevent different types of cancer in the future. So this is kind of a summary of some of the studies that I've looked through over the last few weeks in preparation for this talk. And probably the number one thing is to get even a minimal amount of exercise on a regular basis. For overall health, exercise is one of the best things you can do to keep yourself moving. But especially for cancer prevention, they're finding that exercise can greatly reduce your risk. This plays into, having a normal body mass index. Patients who have higher BMI, it's related to higher risk of breast cancer, colon, esophageal cancer, uterine cancer, and kidney cancer. So making sure that you're exercising and you're keeping your body weight in a normal range, really we find that those patients have less risk of cancer as well. Eating is probably the hardest area for patients. Honestly, it's the hardest thing for me as well. We're bombarded constantly with all of these like overprocessed, high in sugar foods. But it is really important to make sure that you are eating a really healthy, well balanced diet most of the time. Obviously, there's going to be times where you're going to need to go off of that, but if you can, 80 to 90% of the time, if you can eat, a whole foods diet, you're going to be better off in the long run. So just making sure that you're increasing your vegetable intake and whole grains as well. So 5 servings of fruits and vegetables per day can decrease your risk of obesity and cancer. So we're making sure that we're filling our plates with vegetables mostly, Fruits, some, we want to make sure that we're eating plenty of vegetables over fruits. But if you kind of adjust the amounts that you have on your plate and add in more vegetables and reduce the amount of other types of foods, they're going to be less calorie dense for you. You'll have more nutrients and more antioxidants in them as well. So increasing intake of fruits and vegetables, 5 servings a day, and a serving is really only a half a cup. So it doesn't mean you need to them 5 times a day, but just making sure that you're, eating quite a bit, even if you're just eating them at lunch and dinner, eating a cup to a cup and a half per meal will take care of that for you. Whole grain foods can reduce the risk of cancer. And there was a study that showed that the patients with the highest fasting blood sugar had the highest mortality rates from cancer. So we know that blood sugar does have a correlation with, like getting cancer in the first place, but also for your mortality rates when you have it. So focusing on whole foods, reducing sugar intake is really important for overall health, but especially if you're looking to prevent cancer from occurring. This one was really sad to me. Limiting your alcohol. Even 1 glass a day can increase your risk of breast cancer, and there are several well done studies that show that. There was the question of red wines have antioxidants in them, but really it's the alcohol content in it. So reducing or eliminating your alcohol intake is going to help you in the long run. Men, 2 glasses a day increases their risk for cancer. So, this is definitely an important one to make sure that you're keeping track of how much alcohol you're consuming every day. This is a really important one, and this is, avoiding environmental estrogens and endocrine disruptors is not something that's talked about very often. So, we talked about like diet, exercise, alcohol intake, but this is kind of a whole nother realm where patients are like pretty easily confused because there's a lot of marketing schemes that can confuse people about how healthy their personal care products are. But things like plastics, fragrances, parabens, and phthalates that are all over in our world, they actually can leach things that are endocrine disruptors into our body. So what we put on our body, what we use to store and heat up our food is really important. So when we're talking about, having healthy levels of the healthy types of estrogens, and we want to look at patients' environments, I tell them first, no plastics at all. If you can get away completely from using any kind of plastic storage containers, plastic water bottles, any kind of plastics in your home, I highly recommend doing that for everybody. That's across the board. Those plastic containers that we heat food up in the microwave, terrible. You are leaching all kinds of chemicals and endocrine disruptors right into your food. So even if you do use like microwavable meals, I recommend putting them into another bowl and heating it up in that. So make sure you get glass containers and don't warm things up in plastic. And then get like a stainless steel water bottle or glass water bottle. Stainless steel is probably a little easier. All those plastics leach into your water, and some people drink them on a regular basis. So we really try to avoid any kind of plastic exposure in our home. The second bullet point talks about more about personal care products, and that website is actually incorrect. It is, I'll show you what it is. But there is a website that's called Skin Deep through the Environmental Working Group, and I have them on there 2 times. This group does a lot of research on environmental exposures to different toxins. And this is such an amazing resource for patients. So I'm gonna see if I can figure out how to share my screen with you guys. I just wanted to show you this Skin Deep website. So if you can give me 1 second. I may not be able to figure out how to do it though. There it is. Okay. Oh, never mind. It's not going to do it. Okay. Anyway, so Skin Deep is if you go to Environmental Working Group, EWG.org, and look up Skin Deep, their products are, or they have a product search function that you can actually type in your, how did this work? I'm sorry, I'm having technical issues here. Okay, there we go. Okay, so back on track. If you go to Skin Deep or EWG and type in skindeep.org, you can search any of your personal care products. So you just type in the name and it will tell you on a level from 1 to 10 how many chemical and toxic elements there are and how safe it is for you to use. So when patients are trying to avoid estrogens and endocrine disruptors, if you have any kind of estrogen metabolism dysregulation, if you have a higher risk of breast cancer, I highly recommend checking out these awesome resources that we have available for us. They've done all the work for you. You don't even have to look at the ingredients in them and try and decipher, what all these crazy ingredients are. You can just type it in, and most products are in there. They also have an option where you can purchase their products that are already certified. I think they call them Skin Deep certified. So that's a great option for sunscreens, lotions, topical products, all that. And then the other part of this is, making sure that you're buying organic foods when possible. This same organization, EWG, also does what's called the Dirty Dozen and the Clean 15. And every year they measure the amount of pesticides that are sprayed on foods, fruits and vegetables, and they give you the worst offenders. And so, buying organic is crazy expensive, but this is a way for you to know that, I don't have to buy things like bananas organic because they have a thick skin on them. So even if they're sprayed with pesticides, there you don't have to worry about getting into your bloodstream as much. So things like apples, blueberries, trying to think what else. I think broccoli. There are 12, yeah, sorry, 12 things that you should be buying organic and 15 things that you don't necessarily need to if that doesn't fit in your budget. So I recommend going to ewg.org and exploring around there. There's a lot of information on how to avoid, not just parabens, phthalates, fragrances, but also, food sources of endocrine disruptors. Like I mentioned before, we do a lot of hormone replacement therapy here at the office, and there's a lot of reasons for that. Typically people think of hormone replacement for women that have hot flashes, night sweats, they're going through menopause, and that's it. But really, there's a long list of reasons that women and men should consider hormone replacement. Not just feeling better, but also, it has benefits for bone growth if you have osteoporosis, osteopenia, heart health, brain health, and then breast health. So this was a study that was done, was started in 2010. It was a multi-year study with specifically pellet hormone replacement therapy, which is my preferred way to provide hormone replacement for men and women. This multi-year study showed testosterone alone or testosterone with estrogen was shown to decrease the incidence of breast cancer in pre and postmenopausal women. And that benefit goes up after hysterectomy. So what we see is long-term women who are deficient in their sex hormones, testosterone and estrogen specifically, that they are at a higher risk of breast cancer. And so I was looking over this study earlier and I thought the numbers were really interesting. So the incidence of breast cancer in women who were not taking any hormone replacement therapy was anywhere between 220 to 330 women per 100,000. So that's non-treated women, 330 to or 220 to 330 per 100,000. In this study that was done over 10 years, that number was about half, 144 out of 10,000 or 100,000 women. So we do see a significantly reduced amount of breast cancer in women who are long term on hormone replacement therapy. And this conversation I have with patients is, what is it safe? We have, and even a lot of providers still have this kind of bias against hormone replacement therapy because there was a study that was done about 30 years ago. And they were using, it was not bioidentical hormone replacement therapy, it was synthetic, really strong forms of estrogen, no testosterone, and breast cancer rates were going up and rates of stroke. And so the consensus was after that, stop hormone replacement therapy. Women don't need it. It's dangerous. We're not going to do it anymore. So for a long time, and there was this kind of like mass fear about doing hormones. And really, what we're seeing is that that is the opposite with bioidentical hormone replacement. When it's done at a safe level, when it's done in an appropriate manner, topically or under the skin with pellets, and not orally, we see reduced risk of breast cancer, uterine cancer, Alzheimer's disease, osteoporosis, and osteopenia. So, long term for health and cancer prevention, I do recommend hormone replacement therapy for women. All right, going back to diet a little bit, there's a lot of information out there about antioxidants, and it is what it says. It's an antioxidant. Oxidation is what causes damage to all types of cells in our body, including breast cells. But like anti-aging, we look at antioxidants, general health, heart health. All of those can be improved with a good antioxidant status. One way to do that is to just eat more foods that have lots of antioxidants, which are like dark skin berries, so goji berries, raspberries, blueberries, strawberries, and artichokes both have a good amount of antioxidants in them, and thankfully dark chocolate does as well. So you can indulge in a little bit of dark chocolate. Probably the most effective way to do it would be to do either supplementation of N-acetylcysteine, which is an amino acid that converts to glutathione in the body, or things that have a large amount of antioxidants in it. So there are supplements that have a lot of antioxidants in them. But we can do glutathione injections here in office. It's a very powerful antioxidant. We use it for anti-aging purposes, but also for patients that have any kind of like fatigue or long-term disease, diabetics who have like high levels of oxidative stress in their body. Glutathione is wonderful for them. And then, there was a study, green tea has a lot of antioxidants in it. So green tea decreased risk of breast cancer, 1 cup a day, breast cancer reduced or recurrence reduced by 25%. So there's a lot that you can do at home as well to help reduce your risk of breast cancer and recurrence. There's a lot of studies about vitamin D levels, and we do check that as part of our kind of intake lab panel because it's so important. Like, it gets frequently missed. There's a lot of when people have low vitamin D status, not only are you at higher risk for cancer, but also muscle pain, joint pain, fatigue. Trying to think what else. Depression is a big one. If you struggle with depression or mood swings, vitamin D can be causative. So we always make sure we check vitamin D. It's an easy vitamin to take to boost your levels. But really what we're looking at is between 50 and 80. And I rarely see people who are not supplementing at that optimal level. And then, there's study after study with vitamin D and breast cancer, but patients who were diagnosed, they checked their vitamin D levels. And the patients who were diagnosed had a much lower level of vitamin D. So we do know that patients who have optimal levels of vitamin D tend to have less risk of breast cancer. And that vitamin D and breast cancer correlation only increases after menopause. And this is not prevention, but screenings are important because obviously the earlier you can detect, the better your outcomes are likely to be. So we do want to make sure that starting at age 40, which is going to be me here coming up pretty soon, women should be having a mammogram starting at age 40 and then every 1 to 2 years, depending on your risk factors. So that would be up to your physician how often you need to have that done. And then they do recommend that you have it up until age 75. And that is the end of my presentation. This is our contact information. You can give us a call at 928-277-7414. If you have any questions, our website is up there. You can take a look at any of our services that we offer. We do offer free 15-minute consultations for a variety of services, and we hope that you check us out. If you have any questions, I'll stay on for a few minutes. Go ahead and type it into the chat box, and I'd be happy to answer them for you. Thanks for joining us today.